Very good afternoon, one and all. The title of my presentation is Internal Audit to Assess the Spectrum of Corneal Diseases with the Systemic Association. As we all know that there are a number of systemic conditions that affect cornea. Some are having very obvious systemic findings, while some are not. The endocrine disorders, infectious conditions, autoimmune disorders, inflammatory disease, and genetic disorders are the various diseases which can manifest with corneal manifestations. So a routine eye examination can bring attention to potentially life-threatening illnesses as well. This study was done with an objective to describe the spectrum of systemic disorder with corneal manifestations in patients presenting to the cornea clinic of a tertiary eye care facility in eastern India. It was a retrospective study. The data was collected from the Cornea Clinic, Department of Ophthalmology, AIIMS Patna, for the duration of 15 September 2020 to 14 September 2021. All the clinical records of patients with suspected or proven systemic diseases were collected, the blood investigations were traced, and patients who had positive blood investigations were included in the study. So a total number of cases, and this period was the COVID period, the first wave of COVID had come during this period. So a total number of cases attending cornea clinic during this period was 472, that means an average of 10 patients per cornea clinic. Total new cases were 243, that means 5 new cases per cornea clinic, and 26 patients were identified with systemic diseases during our study. So these are the systemic diseases that we encountered, and with the following clinical feature, that is the corneal manifestation. Primary Sjogren syndrome and secondary Sjogren syndrome manifested as severe dry eye, filamentary keratitis, and confluent SPKs. Patients with Stevens-Johnson syndrome and mycoplasma-induced rash and mucositis presented with lid margin keratinization and corneal vascularization. Patients with GVHD, SLE again presented with severe dry eye picture. Patients with Wegener's granulomatosis presented as necrotizing sclerokeratitis and peripheral ulcerative keratitis. Patients with vitamin A deficiency presented as keratomalacia. So these were the various systemic diseases which we could identify primarily in the cornea clinic, and these are the corneal manifestations which have been mentioned in the right. These are the clinical pictures of some of our patients who were for the first time seen in the cornea clinic and subsequently referred back to the respective departments. Patients with systemic lupus erythematosus who presented for the first time with filamentary keratitis and retrospectively diagnosed to have systemic lupus erythematosus. Same year, this patient, because of proptosis, presented to us, but had left eye corneal ulcer, but actually the patient was having acute myeloid leukemia, and because of that, he developed exposure keratopathy and secondarily got infected to have fungal keratitis. Similarly, this patient with necrotizing sclerokeratitis had Wegener's granulomatosis, and this patient had bilateral corneal ulcer, which was actually because of vitamin A deficiency. So to conclude, there are a wide range of diseases that present with features consistent with dry eye. Dry eye diseases not responding to the usual treatment should be thoroughly investigated and appropriately referred to rheumatology wherever needed. And subtle corneal clues can suggest the systemic diagnosis. And this is helpful in cases where we know that there are various systemic diseases that adds to the morbidity, but there are certain diseases that adds to the mortality as well, like Wegener's granulomatosis. So just the corneal clues, if you identify in time, you can save somebody's life. With this, I would like to conclude. Thank you.
So, Prabhakar, good study. Did you look at the cases in a reverse way, in the sense that of the patients who presented to you, how many did the hospital detect to have a systemic problem?
Yeah, the list that I had shown, not all patients that were diagnosed retrospectively, like patients with SJS were referred to us. Similarly, patients with GVHD was referred to us. Rest of the patients, like patients with cicatricial pemphigoid.
So can you just quickly give the numbers? So how many in your cohort had already came to you diagnosed with disease?
It's around 10. Out of 26, 10 patients were diagnosed retrospectively from the cornea clinic.
Did you look at corneal manifestations of diabetes? Because that's a very common systemic disease and can